Hi everyone, today I will introduce the short implants. In clinical practice, you often encounter patients with insufficient vertical bone height. In the mandible, the presence of the inferior alveolar nerve, and in the maxilla, the maxillary sinus, can make placement of conventional implants challenging. In such cases, bone grafting has traditionally been considered almost essential. But with short implants, grafting may be avoided. Let's look at the benefits. The first benefit is for that bone grafting is not needed in cases of insufficient vertical bone in both the maxilla and mandible when using the short implants. More specifically, it can be effectively used in patients with posterior vertical bone height of 6.5 mm or less. Depending on the vertical bone condition, the implant placement depth can also be adjusted flexibly. For example, in the posterior mandible, in cases where there is only a limited distance remaining close to the inferior alveolar nerve, implants with 6 mm, 5 mm, and 4 mm specifications can be placed safely while avoiding the nerve. Likewise, in the posterior maxilla, in cases where the residual bone under the maxillary sinus is limited, 6 mm and 4 mm specifications can also be utilized. In the past, when these kinds of cases were encountered, clinicians had to perform bone grafting first, wait several months, and then placing the implant. With one short implant, however, you can significantly reduce the treatment period while lowering the burden on the patient. Short implant design, stable osseointegration even at a short length. At this point, you may be wondering, it's short, but can it really be trusted? Let me explain from a structural perspective. The short implant is available in 3 diameter options, 0.5.0, 0.6.0, and 0.7.0. Because of its wider diameter, it can secure sufficient surface area for osseointegration required for implantation, despite its shorter length. You'll understand this more quickly when you look at the surface area data. As you can see in the table, the surface area of the conventional implant and the short implant is almost equivalent. For example, the 0.5.0 x 6 mm specification provides a surface area of 122 square millimeters, which is almost identical to the 121 square millimeters of a conventional 3.5 diameter x 8.5 mm implant. In other words, although the implant is shorter in length, its wider diameter effectively compensates for it. In addition, by applying 2 machined surface bevel options, 1.2 mm and 2.2 mm, the soft tissue response has also been improved according to the placement depth. Its clinical performance has already been verified as well. A multi-center prospective clinical study confirmed a 96.6% survival rate. So, just because it is short, it is by no means a compromised product. To place the short implant safely, a dedicated drilling kit is required, and we provide the 485 kit together with it. Let me explain this through 2 key points. First, prevention of inferior alveolar nerve damage. With a conventional surgical drill, there is a wide dimension area at the tip of the drill, which causes the drill to penetrate deeper than the actual implant length. For example, even when placing a 6 mm implant, the drill may go as deep as 6.3 mm. In contrast, our 485 drill does not have a wide dimension area, so the drill length is almost identical to the implant length. This allows you to secure the maximum possible safety distance from the nerve. In addition, the 485 drill is designed with a reverse cutting-edge structure at the tip, which provides an additional level of protection against inferior alveolar nerve damage. Second, all procedures can be performed with a single kit. Not only all short implant specifications, but even conventional 8.5 mm implants can be placed using this single kit. From the guide drill, pilot drill, 485 drill, mount driver, all the way to the implant driver, the entire procedure, from drilling to implant placement, can be performed in one seamless workflow. Without the need for any additional kits, this one kit covers everything. Now, let me show you some actual clinical cases. First, if you look at this posterior mandibular case, diameter 5.0 x 5 mm implants were placed in the number 37 area, and diameter 5.0 x 5 mm implants were also placed in the number 46 and number 47 areas. As you can see from the radiographic images, the procedure was completed while maintaining a sufficient safety distance from the inferior alveolar nerve. Now, if you look at this posterior maxillary case, a diameter 5.0 x 6 mm implant was placed in the number 16 area, and a diameter 5.0 x 5 mm implant was placed in the number 17 area. In another case, a 4.5 x 10 mm implant was placed in the number 15 area together with a 5.0 x 5 mm implant in the number 16 area. The key point is that even in situations where the residual bone below the maxillary sinus is insufficient, highly predictable and successful outcomes like these can be achieved without bone grafting. That was the overview of the short implants. Thank you.